So in our infusion department, we take care of a variety of illnesses, whether it's acute or chronic. It could be cancer patients, patients who need a blood transfusion, antibiotics, chronic diseases like rheumatoid arthritis. For COVID-19, we give a treatment that's called monoclonal antibody therapy. So monoclonal antibodies are a lab-developed antibody that comes specifically from immune cells that are produced when somebody is sick with some sort of disease. They create immune cells, B cells. Those are removed from the blood, and the monoclonal antibodies are developed to mimic and enhance those immune cells or B cells in a person. So patients respond really well. It sure depends on the viral load on each patient. So the higher the viral load, the less effective this medication is going to be. So if I have somebody that's very sick and they are on day 9 or 10 of their symptoms, the viral load in that person is very high. So this medication will go after that virus. However, it is still going to take the body a long time to be able to heal from the damage that's been caused already from the COVID virus. So they will get better. However, it is going to take them longer. Rather than the person who comes to see us on day 5 of their symptoms, those people successfully are feeling much better within 24 hours. The studies that I've read nationwide have shown huge relief of COVID symptoms and very successful keeping patients out of the hospital and decreasing mortality rates. Locally here, we have seen that to be true. Patients that we would routinely see over and over being admitted to our hospital for worsening COVID illness are able to get this monoclonal therapy and recover at home, where if they didn't get it, the chance of them being admitted to our hospital or even our ICU is a high likelihood of happening. The monoclonal therapy is a nationwide study, so there is criteria for patients that can and cannot have it. However, the criteria is incredibly broad, so it's a high likelihood that most of the population would be eligible for this treatment. And especially, this is the treatment that we want to give to people who are high risk of becoming incredibly ill with COVID. A patient who is ill with COVID, we have 10 days to give this medication. Within that 10-day window is the best success for getting on top of that viral load and our patients recovering quickly. After that 10-day window, or if a patient is admitted into the hospital, they would get a different type of monoclonal therapy and not the targeted therapy that we give on an outpatient basis. There are advertised IV therapies for COVID treatment, which are supplemental treatments, hydration, vitamin C, B12 complex, all of those supplements that are supplements for the body. However, not effective against COVID-19 as the monoclonal antibodies are. The monoclonal antibodies are a targeted therapy and genetically target COVID-19, where vitamin C, B12, and zinc, etc., are great supplements to help you, however, not successfully like the monoclonal antibodies. This is a therapy that I would absolutely make my family do. If my mother, my grandparents, my husband even, children came down with COVID-19 illness, this is a therapy that I would 100% recommend that they get. We are having tremendous positive results with this therapy, and I cannot emphasize enough how important it is for the recovery of this illness.